autoimmune. Okay, autoimmune can also cause ulcers. What do you mean by autoimmune? So we have a condition called as autoimmune gastritis. In this, what happens is the antibodies are basically formed. So these antibodies, what do they do? These antibodies are formed against the parietal cells. So parietal cells, basically they have a pump called H positive, K positive, ATPase pump. So this pump which is present in the parietal cell is mainly responsible for producing lot of, this pump is responsible for stimulating the parietal cells for producing the acid. So whenever the antibodies are formed against the parietal cells, so obviously what will happen? HCl production will go off, okay, and intrinsic factor will also go off. So what will happen because of this? So because of the loss of H positive acid and this intrinsic factor, patient will develop pernicious anemia, but also acid production is gone. So who will get stimulated? That G cells which are sitting in the antrum. They will think, oh my god, why is acid production not occurring? Let me go and stimulate the parietal cells. So this will cause hyperplasia of the gastrin producing cells. Okay, so there will be a lot of hyperplasia of the gastrin producing cells. Okay, so now what is happening? These antibodies have stopped parietal cells from producing acid, but these antibodies can damage the epithelium. Okay, so they can cause inflammation. Whenever there is an antibody production, so it can cause inflammation and damage to the mucosal barrier. So now the mucosal barrier will get damaged, and these patients can also develop ulcers. So that is another kind of ulcers which occur here. Remember, these kind of patients in which we have autoimmune gastritis, there is usually hyperplasia of the G cells. Okay, G cells. So they can later on develop even carcinoid syndrome. So there can be so much gastrin G cell hyperplasia that they can develop carcinoid syndrome later in their life because of gastrin over secretion. Okay, so anyhow, so these are the predominant cause of gastric ulcers, but that's not always the case in duodenal ulcer. Okay, so the main culprit for the duodenal ulcer is acidity. Okay, so duodenum has never been exposed to acid. For duodenum, acidity is never my cup of tea, isn't it? So stomach will neutralize the acid and the food will come to me. Okay, plus the second thing that happens in the duodenum is that pancreas produces lot of alkaline secretions which neutralizes the food. So what happens now? So what happens now is that food is there. Due to any cause, if the hyperacidity, excess acid enters into the duodenum, this acid, so duodenum will be like, oh my god, from where is this acid coming? It's not able to bear it and it will get ulcerated. So main cause of duodenal ulcer is hyperacidity, and it occurs either when the transit time of the food is increased in the stomach due to any cause. So because of that, the excess acid will enter into the duodenum, or second, the reflux from the pancreas is decreased. Okay, so when the reflux from the pancreas is decreased, automatically what is going to happen is that the alkaline secretions is not going to come. So whatever acid is coming is also not neutralizing. So again, it will cause ulcers. Okay, so duodenal ulcers usually occur due to hyperacidity. So that is the main culprits, the main etiology behind the ulcers before we go to anything. So because we have studied the main etiology, so here only you will be able to understand the clinical features nicely, so that you can write in your exam also and you understand this in your real life also. So you know what will happen. So patients with gastric ulcers, so if the gastric epithelium is sloughed off, okay, there is no gastric epithelium mucosa, so what will happen? As soon as the patient eats the food, what is going to happen? Your stomach will start producing acid. So now already the mucosal barrier is broken. So this acid will start more damage. So patient will start having pain. So as soon as the patient eats the food and he starts getting pain, that's a very classical history that is given by the gastric ulcer patient, that whenever I eat food, I start getting pain. That is a typical history of gastric ulcer. But what will be the history given by the duodenal ulcer patient? What will duodenal ulcer happen? So whenever the patient is hungry, okay, he's wanting food, so food is not coming. Okay, so because of hunger, so whatever acid is left will enter into the duodenum and it's damaging. Now as soon as the patient eats the food, okay, so this food will neutralize whatever acid is there, it will be neutralized. Okay, so now this acid will not enter into the duodenum. So patient will say, oh, I'm feeling so relaxed, no pain now. So what will happen? So duodenal ulcer patient will complain of pain whenever he's hungry, and he will give you a very typical history. As soon as I eat the food, the pain disappears. Okay, I feel so good after eating the food. You know, that's a very typical history of duodenal ulcer. Why? Because when he's not eating the food, he's having hunger pangs. At that time, acid is produced, and that acid goes into the duodenum and causes pain. But as soon as he eats the food neutralizes the acid and he says, I'm so relaxed. Okay, so that's what happens. So remember, that's a classical history. Food causes pain, gastric ulcer. Food relieves the pain, duodenal ulcer.